Hey everybody, this is Dr. Jason Dean. You can head over to drjasondean.com to find me. And today, going over a couple MVX Plus tests. MVX Plus Metabolic Vulnerability Index tests. If you go to drjasondean.com, you'll find a red button top right. Okay, my mouse goes over to it. Once my mouse goes onto it, it goes blue. Don't worry, I didn't click yet. And then if I click on it, it actually takes me over to the MVX Plus test, okay? So check that out, and let me dive in. So we're just doing a couple a day, most likely, is what it looks like right now, and I'll fine-tune this as we go forward. Now with these, I've seen dramatic numbers, and as I go through some of these videos and I start posting more, I'm gonna probably do an info sheet to start off with, because this test started and was released back in January of 2025. So we've been a little over 6 months or so now on this test. But this was a cardio test originally. It's actually done in a cardio hospital type setting. But it shows cardiovascular health overall. It shows liver health overall. And it shows some kidney health overall. On top of that, it goes over toxicity, it goes over inflammation, infection as well. And when I say infection, I don't mean oozing wounds. I mean systemic blood infections like parasites, viral loads, bacterial, fungal, you name it, things that people actually get, okay? It shows that. But then it goes into rebuilding the body, absorption of nutrients, carbohydrate breakdown, and malnutrition, technically, okay? So let's jump in. I'm going to go to full screen here so you guys can see it. This is the first one. Now, this is a dramatic one, okay? This one is very, very dramatic. I do not see them like this all the time, but I do want to show you what it looks like when you have something as dramatic as this. This is actually a cancer case. This is actually someone who is doing very poorly, was giving a poor prognosis, I believe actually hospice care as well. So when I go up to full screen here, you'll see the top number here is what's called the Metabolic Vulnerability Index, okay? Their number is 79. Now, obviously you see, based on the reference interval, over here to the right is the reference interval, you'll see where my mouse is. I can highlight that right there. There we go. Highlighted that. These are the reference intervals. These are the bottom numbers and the top numbers. Now, most people would say, oh, well, as long as you're within those, everything is fine. No, that's not true. Not everything is fine. I actually look at numbers within these as well. Okay, so it's not, I'm not looking to be under 63. If you're 60, that doesn't mean you're okay. I want something far lower than that. Just like down here, it shows small HDL particle number between 11.5 and 21.6. No. Yes, that's general, but I want specific numbers within that, which we'll go over, okay? So the MVX number is 79. Their overall metabolic vulnerability index is 79, which is way too high. That's not good. That is a high mortality index. Mortality, how close they are to passing, to death. Below that is an overall number. So this number encompasses the glyc-A and small HDL particle. 77, also extremely, extremely high. I'm going to go to the two numbers that make it up. Glyc-A. Now, I don't actually know if I've seen a number this high. I don't think I have so far. Now, I want people under 300. They're at an 821. That means massive inflammation, massive infection. When I say massive infection, we're talking bacterial, parasitic, viral, fungal. But this is out of control right here. This is absolutely out of control. I go down to the small HDL particle number, 7.6. That is too low. This is toxicity. I want between a 19 and a 21. So you'll see, very, very messy. 7.6. Not even close. Even if I doubled that to say 15, we're still not close to the 19 to 21. We come down here to the metabolic malnutrition. Literally, their body is malnourished. Malnourished, meaning they're not getting nutrients. They're not repairing. They're not healing. This number is a 73. just, again, the numbers speak for themselves. This is super high. I have spoken to this person. We've discussed this. Down below is citrate. Citrate is a liver number. That number, again, way too high. Fatty liver disease, whether alcoholic fatty liver disease or non-alcoholic fatty liver disease. That means the liver is completely backed up, most likely loads of parasites, loads of toxins. And then with all of that going on, this person has no nutrition. They're not absorbing. No matter what they're eating right now, they're not absorbing it. Their valine is low. It's not even on the radar. And then these two are within, but they're still super low. You can't operate with these two numbers, and you cannot operate with this number. Again, this is a dramatic extreme case. This is a cancer case. I don't see them all like this, but here's the problem. I do see a lot of people who are definitely out of the range that I want them to be in, and they're also out of the reference ranges. So this is not the only one I get, okay? So that one is really bad. Obviously, I've gone over with that person, working on getting something done about it. That's an extreme case. I'm going to go now to a less extreme case, okay? And I want to show you, even in a less extreme case, how these numbers can still really get out of control and what they actually mean, okay? So let's go to this one. We have MVX top score of 50. Now, again, that's within the number, but it's still too high. That's going to rank at about the 10% mortality over the next 5 years. Way too high. That should be, this number, I want under 30. It's hard to find them under 30. Inflammation, they're at 50. That's too high. They're going very rapidly up toward the 59. That's way too high. Glyc-A, infection, inflammation, they're at 384. They're almost near the borderline. And this should be under 300. I don't want this high. I want under 300. Again, the toxicity number, small HDL particle number, they're at 13. That should be 19 to 21. They're 6 points off where I want it from. Okay. Their metabolic malnutrition number is going too high. Citrate, going too high, 2.32. That is a congested, backed up liver. That is potentially non-alcoholic fatty liver disease. I talk about it all the time. 90% of the country has backed up, congested liver. These numbers are not terrible. They're better, but the liver is not converting enough of the amino acids. It's not converting it enough to healing, to growth. So, again, this is better, but still, again, high toxicity, high inflammation, high infection. All stuff that we have to get handled, okay? So that's a couple of them today. I'll go deeper as we go with these, but I wanted to just show you what these look like. Here's a couple today. We'll go through a couple more as we go through the week. And if you have questions, if you need help, if you want to know what your MVX Plus looks like, jump on over to the website, drjasondean.com, drjasondean.com. The big red button up top right, it goes to blue. Click on it. Right here, you can watch the video, you can hit your book, your call, it takes you right down to the test. This also gets you a consultation and a report of findings with me, okay? With me. We're happy to help you, happy to help at all time. That is a look inside the Metabolic Vulnerability Index test, or the MVX Plus test. Guys, I appreciate all of you. Have a great rest of your day. Take care. Let's get healthy, everybody. Bye-bye.